is not a drill. There is a killer in our midst. We must take action if we are to protect our canines. The culprit: congestive heart failure. Keep watching to learn how to stand guard against this vicious killer.
Dogs are susceptible to many of the same diseases that humans are. Although most owners take their dog to the vet regularly, many are unaware of the risk of heart disease in their companions.
Heart failure runs in my family. My uncle was diagnosed with heart failure.
All dogs can be affected by heart conditions, some breeds more than others. A few examples of those that are more genetically predisposed to congestive heart failure include boxers, cocker spaniels, and Doberman pinschers. When owners were asked if they knew the risk of heart disease in their canine friends,
I have not heard of congestive heart failure, but we do monitor their hearts because Stella, they thought she had a heart murmur. I don't think that's
No, I didn't. I know dogs can be affected by most of the same diseases humans can, but I've never heard of congestive heart failure in dogs, and I honestly just wouldn't.
Congestive heart failure is a common heart condition where the heart is unable to pump sufficient amounts of blood to the rest of the body, which can result in fluid backup in and around the lungs or into the abdomen.
I'm always more than happy to answer any questions an owner has. The more informed the owner is and wants to be, the healthier the animal. Often owners will come to me having done their research about a condition that their dog may have, and they're ready with questions and looking to be as knowledgeable on the topic as they can be. I really encourage that for the well-being of the animal.
There are many possible causes for congestive heart failure in canines, including birth defects, heartworm, and dilated cardiomyopathy, which is caused by thinning of the heart wall muscle. One of the most common causes, which accounts for about 80% of congestive heart failure in dogs, is mitral valve insufficiency. This means that the valve separating the two chambers on the left side of the heart does not close properly, and inappropriately allows blood to flow backwards.
When it comes to heart disease especially, symptoms are not usually visible from the start, which is why it is so crucial to bring your dog in for regular checkups.
Symptoms become much more pronounced the further the disease progresses. These include persistent coughing and difficulty breathing due to fluid in and around the lungs, exercise intolerance, fatigue, increased breathing rate, distended abdomen due to fluid buildup in the abdomen, decreased appetite, and weight loss. If your vet suspects congestive heart failure, he or she will conduct a series of tests. These include auscultation, listening to the heart and lungs with a stethoscope, blood tests, ECG traces, echocardiography, which can identify thickening or thinning of the heart wall muscle as well as backflow of blood through a faulty valve, and chest x-rays. Treatment will depend on the underlying cause as well as the severity of the problem. Medications such as ACE inhibitors, diuretics, and vasodilators can be used to decrease blood pressure and reduce fluid buildup in the lungs and abdomen. In addition, your vet might recommend a change in diet to regulate weight and limiting salt intake. It is important that your dog get plenty of exercise every day, but keep in mind that breathing may be difficult for dogs with congestive heart failure, so light activity and cage rest is recommended.
Now that I know more about heart failure in dogs, I'll definitely take my dog to get more checkups.
Congestive heart failure may be a killer, but by being an informed owner, you can help protect your canine friends.